The Youngevity UK and Europe Show with Dr. Wallach.
Hi, my name's Jonathan Smith. Welcome to the Youngevity UK and Europe show with Dr. Wallach. Each week we'll go through the Dead Doctors Don't Lie show and handpick information regarding people's specific health concerns. So listen now as Dr. Wallach gives his expert advice on how to deal with the root cause of illness and disease nutritionally. If you would like further information on the products recommended in the show, they can be found in the description below the video. Enjoy the show.
The Youngevity UK and Europe show.
Doug, what pearls of wisdom do you have for us?
Well, I thought we'd talk about, you can't hardly be in an airport or any place out in public without looking around and seeing just about everybody staring at a smartphone or a tablet of some sort. And I've got a story here from ABC News headline, more screen time linked to higher risk of ADHD in preschool-aged children, according to this study from the University of Alberta. They say you might want to think twice before you hand your preschooler a smartphone or tablet to keep them entertained. Said that in this new study, they found that by age 5, children who spent 2 hours or more looking at a screen each day were 7.7 times more likely to meet the criteria for a diagnosis of attention deficit hyperactivity disorder, or ADHD, when compared to children who spent 30 minutes or less each day on a screen. According to the lead author here, Dr. Piyush Mandane, Associate Professor of Pediatrics at the University of Alberta, says children should develop a healthy relationship with screens as young as 3 to 5 years of age. And it says our data suggests that between 0 and 30 minutes per day is the optimal amount of screen time. The American Academy of Pediatrics actually recommends an hour a day, but it does say viewing quality programming for preschool children ages 2 to 5, and said they encourage the parents to watch with their children and guide them through the experience. As the investigator on the nationwide Canadian child study, Mandane has been following children from mid-pregnancy into childhood and adolescence with screen time on the rise among children. Says that there's no surprise when parents began asking how much is too much for our children. Current study was conducted by gathering information from parents about their children's screen time during their 3 to 5 year follow-ups. Team also collected comprehensive behavioral assessments at the 5-year visit, finding that children who reported screen time in excess of 2 hours a day were more likely to exhibit behavioral problems by the time they turned 5. Conversely, children who spent 2 hours or more a week participating in a form of structured physical activity is less likely to have experience of mental issues. The study could not establish a clear cause and effect relationship, but Mandane does suggest 3 tips for promoting healthy behaviors in preschoolers. Take advantage of built-in apps to monitor screen time exposure. Best to avoid screens at least 1 hour before bed, and encourage organized physical activity. So there you go. You see a lot of little kids on these things, too.
Yeah, and I agreed with the author that certainly this does not give you a direct connection. There's an association, and I would do hair analysis on all these kids, and I'll bet you they all have deficiency of that nutrient. There's one nutrient that's missing when kids have ADD, ADHD, autism, let's see here, any of the autistic variations, okay, and then you have also violent behavior and so forth. These are the kids who are in trouble because they're deficient, and of course they connect with that machine as opposed to connecting with other people, okay? And of course they have Asperger's and all this other stuff, which are, again, these variations on autism. And so it's one of those things where get that hair analysis, get that book, Rare Spin Cures, get that hair analysis, and I think you will be freaked out when you find out how many of these kids. This was a study in 27 states, tens of thousands of people involved. There's no doubt about it. These kids have a deficiency that causes them to have sudden heart death, as well as all kinds of other stuff. Read the book, Rare Spin Cures.
The Youngevity UK and Europe show with Dr. Wallach.
Thanks for listening to this week's show. If you're listening on YouTube, subscribe to the channel, and for more info on the products mentioned in this week's show, check out the links in the description.